My name is Alexander Vartanov, and I'm in the bone marrow transplant department, cellular therapy department, and treat primarily patients with leukemia, myelodysplastic syndrome, and a whole host of other hematologic malignancies. Within our department, I treat all blood cancers, so leukemia, lymphoma, myelodysplastic syndrome, myeloproliferative neoplasms. We see patients with all of these conditions, and then we also do stem cell transplants as well as cellular therapy. So we cover a pretty broad range of treatments for a wide variety of hematologic malignancies, not just one in particular. I think one of the most important parts of my day-to-day practice is how closely we work with our pathology colleagues. There are new developments seemingly every week in various molecular pathways that we can explore as a therapeutic strategy. And so that's where that multidisciplinary aspect, working with our pathologists and trying to identify and best characterize people's disease at a very deep molecular level, helps us to tailor a more personal treatment approach. Our department is also moving very quickly forward with cellular therapy, which is a very exciting development in the field, and I think our department and Fox Chase in general is at the cutting edge of that. I can't stress enough how important I think it is to connect to people on a human level. Cancer is a scary thing for most people to experience, and so it really is such a privilege to meet people at that point and to be able to have these conversations that are really, they're raw, they're vulnerable conversations, and people welcome us in for that. They let us come in for those conversations. We're here to listen, and we want to come up with not just a treatment plan, but a path forward, taking the person into account and taking their emotions into account and the changes this brings in their life.